on our card we had a PEEP of 7. To add in PEEP, it's external. So here's your PEEP button knob here. Under it are the connections, so you need to pull that one off and switch it with the exhalation valve tubing. PEEP in expiratory, positive in expiratory pressure, exhalation valve. Make sense?
So what you doing?
You just swap. This is the exhalation valve. So you just swap it with the PEEP tubing, the PEEP valve tubing. So
does it need to go on a specific side?
no. Alright, we see that? Okay, now you can actually twist the knob to set PEEP. So make sure it's turned off before you put it in line. So, if y'all want to come see now, right now the knob's falling to 0, so you don't have any PEEP set, right? Because PEEP would mean there's still some pressure left in the lungs after exhalation. So, I want to increase it slowly, because when it starts to rise, it'll rise fast. So I'm trying to get it to go to 7. And that looks good. Okay, we see?
No.
So
Show, show me that again. It
See where it's
stops.
falling
Okay,
back, yeah.
so when it
Where
falls
stops
back.
at, yes.
Okay.
You see?
When it falls back.
You'll be given a number.
And so what's the PEEP again? It's just the
Positive
pressure that's in the
expiratory
lungs
pressure.
when they exhale.
After they exhale, that amount of pressure is still in the lungs. It's to keep your lungs from collapsing, increase the oxygenation. Have y'all learned that already? No?
I mean, he keeps it so they don't close and start to reopen.
So why white lights on?
It's
What?
they're receiving a side.
It just has to go back to 7.
So it's supposed to be at 7.
Look at that button reference sheet.
So come down
At the end of exhalation. So when it starts back shooting back up, it should be a 7 and not 0.
Got it?
Right?
Got it.
Right.
Got it. Got it. It falls back down to 7. It'll go up, but it should not go fall.
Alright,
It should not fall down past
and you need
7.
to add in your spirometer so it can read. So add it onto your filter. This is off. This is on. It won't shut up when it's off. On. Off. It won't touch when it's off. So we're gonna turn it on already. So now we're gonna set an alarm. Just remember this is an alarm, so it will go last. Alarms are after it's on the patient. So now we need to set our pressure alarm. Pressure alarm, you wait for a normal breath or press the normal breath button. It's giving them pretty quick, so I don't need to push it. It's going up to about 15. So you watch your pressure to see where it rises to. Your normal pressure limit should be set 10 above whatever it's going to. So it's going to 15. I would turn my pressure limit down to
25.
So that alarm set. Now I move to the sides. I set sides, so I need to set my side pressure limit. I would need to give the patient a side, make sure the side light comes on. It does. Watch the pressure. It went up to 25. So I would need to set the side pressure limit to
35.
35.
She just said it.
Okay. Just remember to watch for your side light. So now you've seen that your patient's normal pressure was only going to 15. So you set that, so if it gets up to 26, then it's going to go off and let you know something's going on with your patient, their pressure's too high. Okay? It may be your patient, it may be your circuit, you may have kinks, it could be a number of things. Y'all have to learn how to troubleshoot because that's an actual checkup. Where I will make something be wrong, and y'all have to figure it out.
I love Easter egg hunts.
You got 2 minutes till you fail. You got 1 minute till you fail.
It'd be like defeating a bomb. Ready?
Last one to set would be your dipstick.
That's what it was.
This thing's dipstick.
That was like walking through a
So what you do is you
minefield.
watch to see where your volume is rising to. What does that look like?
About 500.
500.
You set your dipstick 100 below what it's rising to. So it goes by 1, so you have to set it to 5. You just hold the silver part and set it. So that's about 5. Can y'all see?
You said 100 below?
Yes.
So
Oh,
at
this is
500
before.
should be 400.
Can you get a picture of that?
I'm just saying. You know, point out there.
My bad.
Excuse me. Excuse me. Excuse me. Excuse me. Thank you.
So 500. So you said that would be 65400.
Okay. So we can pull the silver part up or the dipstick part goes down. Like
You hold the
this,
silver
you
part,
oh you hold. Oh, okay.
and then this part goes up and down.
Okay.
So you set it for.
Okay.
I just used to pretend to check my oil. I didn't know what I was doing.
So if your tidal volume goes below that 400 that you set, then it's gonna go off and let you know your patient isn't receiving enough volume.
You have to make sure that's turned on too.
Yes, this is off.
I know this is probably a stupid question, but
Yep.
what is that thing called?
This,
Yes.
the whole thing,
Yes.
is a parameter.
Okay.
So just like your incentives,
Got it.
measuring volume. And then last you have the alarm delay time in seconds. You would set that 1 to 2 above your total cycle time. So what was our total cycle time? The rate was 16.
Right. 60 divided by rate.
You said 1 to 2 above or below?
I'm not trying to calculate in my head. Just
3 point. Oh.
You good for it too,
What was
Jen.
your
That's
total
why I'm
cycle
looking
time?
like I was like,
So you set it at,
4?
but it didn't go too far. So 5 is the lowest one.
And what's that called again?
This is your alarm delay
Alarm
time. So this is 2 alarms in 1. Volume alarm, time alarm, which is also like an apnea alarm because it's going to go off if your patient doesn't get a breath in so long.
And it's 1 to 2 above what?
Total cycle time.
so the time alarm is 1 to 2 above total cycle time.
That's really good.
You got it in your hand.
Good.
Really, really good.
Now
Like
you
it
can check
stops
this
as
one.
soon as you include it.
Now I can check this one.
Yeah, I told him he has to come back and check this
Is
one.
that okay? Okay. What do you do?
Something is bad. I don't know.
We can come check this one out. And then they'll both be perfect.
I thought you relate.
We got all that. Alarms are set. Reassessing patient. Heart rate, respiratory rate, breath sounds. The whole 9.
Chart and leader.
We're going to take a break and when we come back we'll chart.
Go.